I'm going to show you how to treat tennis elbow with your Theragun PRO Plus and all of the attachments. What I've done on my arm is drawn where the muscles attach, where the pain point comes from for lateral epicondylitis, tennis elbow, golfer's elbow. It all starts there. And I drew these muscles so you could see I'm treating the muscles. I'm not going to be treating down here. So the first thing we're going to do is we're going to start with a heated attachment. We're going to turn on the red light. And now we're going to it's on the slowest speed, 1750. And we're just going to slowly treat all of those muscles. This isn't about pressure. It's not about speed. The slower the speed and the lighter the pressure, you're treating yourself. You're intentionally getting your body ready for treatment. And it's really important that you take care and do this right. We want to get it really warm as we can. Right now, this isn't about the pressure. This is about warming up the tissue. So the percussive motion causes mechanotransduction, which causes heat within the tissue. And then we also have a heated attachment that's causing heat from the outside in. We want to get all of those muscles. Notice I'm not down here on my wrist. There's not a lot of muscles down here. The muscles start up here and move up. So we're just going to get all of these muscles, and this feels really good. Nice and slow. We're going to do this for about a minute. So now that I've warmed up these muscles, I'm going to pause the Theragun, and I'm just going to do a little light stretch. Just a nice, easy stretch to see if I'm causing any issues with that. Then the next thing I'm going to do, I'm going to take this off, and I'm going to now use what we call our micro point. This also is about treating the tissue, the skin. It's not about treating the muscles. So we're going to hit this again, red light, slow speed, and now I'm just lifting it nice and easy. You can see I started down here. This is what we call pain modulation, or the pain gate theory. We're treating the tissue, the skin, to help override the pain that the body might be experiencing while you're doing this treatment. And this feels really good. This micro point is one of my favorite attachments, especially for this treatment. I'm going to treat all this area. Again, when you're done with this, we're going to pause. We're just going to do a light stretch. Nice little easy stretch. And then the next attachment we're going to use is the vibrating attachment. So again, we're going to have red light. We're going to turn the vibrating attachment on. And I'm going to put that as close to or on that circle as I can. So I'm just going to hold it right on that area. I'm going to move it around nice and slow. We're warming up that tissue and all of the muscles that attach right on that spot. You can hear the Theragun working. This is really important you get this. And this is literally why we made this attachment, so you can get right on that area. So now that I've done this for about a minute, just warmed up that whole area, now we're going to do some treatment. So I'm going to pause the Theragun again, take the vibrating attachment off. I'm going to put the wedge on. It's my favorite attachment. We have red light, and we're going to turn this up. We want it all the way to the top, 2400. And now we're going to rest our hand, rest the body. You don't want to flex. You want to rest the arm and the hand so that these tissues are super, see how relaxed they are? And now we're really going to get in there. We're going to really start pushing, adding some pressure. This shouldn't hurt, but it should feel kind of like hurts so good. You should be like a 5 or a 6 out of 10 where you can actually promote that type of healing. And we're going to get all the way around, right up into that area. This is the wedge. This is literally why we created the wedge. If you can tolerate getting right on the bone, then go ahead and do that. Sometimes it's a little too much, a little sharp. If that pain's sharp, don't do that. We're going to stay away from that area. So we're going to get all the way around. You want to get right up in there, right in your little fossa here. We're going to get that as good as we can. And now we're treating all of this, all of these areas. Nice, deep tissue treatment. This is the only part that should feel a little bit uncomfortable. And then once you're done with that, we're going to pause this, and now we're going to do a really good stretch. So you do a stretch this way. You can see I hold my hand and pull it that way. I can feel that all the way across these muscles. I'll pull it out a little bit that way, and down this way. Get balance the other way, go back this way to stretch these out here, because sometimes these will also get tight, but you're going to stretch this way. And now we're going to finish with the cold attachment. And you notice this doesn't move. back and forth. It's a solid stationary treatment, and I'm just literally slowly gonna just treat every inch of my forearm that we just worked on. And you can get right on that area. I'm gonna hold that there, just holding it. Don't add pressure. It's just about the cold getting on that tissue. You can slide it if you want, but this is about finishing this treatment. The ice or the cold finishes the treatment. So you're done once you've done this part. You're going to do this for about 2 minutes. That's how you treat tennis elbow with your Pro Plus. Now, when you look at this, you should be about 1 minute with the heat attachment, 1 minute with the micropoint attachment. So you got 1 minute, 1 minute. Then you've got about 1 minute with the vibrating attachment. That one's going to get right on that bone and any of the other areas where you're a little sensitive and it's too tender. And then you're going to really get in with the treatment on the wedge. And this is going to be about a 2 minute treatment. You really want to start working those areas. Remember, you're stretching in between each one of these attachments. And then you're going to finish with probably 2 minutes, 3 minutes, however much you can do. I would recommend minimum of 2 minutes with the cold attachment on those areas. That's an 8-minute treatment. If you've had tennis elbow, you know how painful this gets. So what I'm recommending you doing is you do this every day, twice a day, morning and night. So you got 8 minutes in the morning, 8 minutes at night to treat your own tennis elbow. I promise you, if you do this right, you're going to start to see a big difference. And then you need to implement this into your recovery. This has to be something you're doing all the time. It's not just doing it when it hurts, especially if you're an avid tennis or golf player.